Thank you all for joining us today. We're very excited about today's webinar, Evaluating Telehealth Services. I know I sent out the speaker bio and more information about the Heartland Telehealth Resource Center in the intro emails. However, if you're catching this recording on YouTube, just wanted to do a brief intro. Dr. Molly Brown is our speaker today, which we are thrilled to have her. She is the director of the Heartland Telehealth Resource Center. And just geographically, the Heartland Telehealth Resource Center is a resource and provides technical assistance to folks in the tri-state area, the tri-state being Kansas, Missouri, and Oklahoma. And so she will be going over some of the resources they provide, as well as just those initial steps. We hear from many hospitals and clinics, we want to provide telehealth services, but where do we start? And so this is a great resource of where do you take those first steps. And so with that said, I'll be watching the chat. If you have any questions, you do have the capability to come off mute, or if you want to put your question in the chat, I'll be watching that as well. Thank you for your time, and Dr. Brown, I'll turn it over to you.
Thank you so much for having me today, and I appreciate the opportunity to share some of the services that the Heartland Telehealth Resource Centers offers our region. Let me get my. So really quickly, I do not have any disclosures or financial affiliation with any of the items I'll be presenting today. There are some resources that I'll be sharing, so I just wanted to make sure that was clear. I do want to give some acknowledgments to our partners. We are housed, the HTRC is housed at the KU Medical Center in Kansas City, and then we partner with the OSU Center for Health Sciences, and then the Missouri Telehealth Network. We are funded by the Office for the Advancement of Telehealth, Health Resources and Service Administration grant, and it's listed in the slide. So really quickly, we are part of a consortium, and we are part of 14 telehealth resource centers. There are 2 national telehealth resource centers, one being the Telehealth Technology Assessment Center, which focuses on reviewing technologies, equipment, toolkits for operations. They are doing a lot of work with broadband and anything related to technology. And then the Center for Connected Health Policy, which focuses on federal level and then state level policy and regulations. And then the map shows our partner TRCs that are all regionalized, very similar to how we are. So what we do, as Lara said, is we provide outreach, education, technical assistance, and then also evaluation for telehealth services, telemedicine services, teleservices, all sorts of different definitions. And we do this through various mechanisms. We do have webinars focused on specific topics related to telehealth, telemedicine. We have helpful videos on our website. We did host our first virtual office hours last year, and it went really well. So we will be holding those again, and really kind of a drop-in for people to ask questions depending on our outreach partner and the content that they're experts in. We have a podcast called Telehealth Unmuted, and it's found on Spotify and Apple. We also do Telemedicine Echoes, which we're getting ready to launch our spring series in March. So I'll have a little bit more information about that. And then we also provide one-to-one technical assistance. Our grant supports about 10 hours of support for any clinic or health system that needs a little bit more detail or a little bit more consultation. So a little background about overarching telehealth priority areas. So these are the 8 areas that experts have come together to kind of educate and focus on what it takes to build these services. We all know that during the COVID-19 pandemic and the public health emergency, so many clinics, whether they were tribal, frontier, rural, large cities, large hospital systems, they had to really scramble pretty quickly to maintain continuity of care with their patients. And in many instances, these clinical services realized that it actually was a benefit to their patients. So some have been able to maintain them more long term, while others have had to sort of scale back a little bit because, some of those regulations have changed. That some of them went back to the pre-pandemic time. Some of the billing has changed. And so there's a lot of pieces that go into it, but these are the areas that they really focus on. And we talk about the digital divide being accessibility, internet access, um, digital equity, digital literacy, and the gaps that exist now that we have virtual settings that can really increase access, but we then have to consider the accessible side of things. Quality assurance or quality improvement, that includes data and performance metrics, policy, legal, and licensure, tied directly to reimbursements, which is the financial supports. Then clinical delivery, which can include education, workforce training, care team training, clinician training, and ensuring that the care teams and those involved in the clinic have what they need to deliver the service. Implementation operations, that's the start to finish, it's the patient journey. It's also, from my perspective, the clinician journey too. So those are the things you have to consider with that. Data and reporting. I'm an evaluator, so I like data. And it's it really can inform you on what's working and what's not working, but then also how you report out to this and how you report, how you're aligning with your goals and, what that data means. Patient engagement, education, we talk a little bit with the digital divide, and then the financial models, which all of it ties in together when you're thinking of these areas to consider when you're either building new programs or scaling existing programs. So today we're going to talk about evaluation and the idea of how it relates to the services that your currently offers. The overall evaluation framework answers the questions who, what, when, how, and why. And it's a whole process related to just the evaluation. I tend to begin any sort of program or project related to any sort of intervention or service. I begin with evaluation in mind. What are we going to want to know at the end of this process? Sometimes it's continuing, it's ongoing, and then quality improvement will be inserted into different aspects of evaluation. So your evaluation is essentially a point in time. How are we doing right now today? Whether it's a process, your implementation, outcomes. Sometimes it's formative. You might collect evaluation information to learn more about what the next steps might be. And it's all directly related to telehealth services or telemedicine services too. And so there's tons of resources out there and on how to facilitate or conduct an evaluation. But if you consider what you're going to want to know either at that point in time or along the way, it helps you decide what you need to measure or what data you need to collect. Sometimes when people consider evaluation, it's after the fact. So they're going back in time and they're checking the data they've already collected, and they realize, we missed opportunities to know more about this scenario or know more about this service that we're offering. And it's okay, because you can always make those adjustments going forward. But if you're looking at building a new service, then it's really important to consider these questions when you get started. And Lara, please let me know if I go too fast. So evaluation in telehealth, we can kind of pull them together into these three chunks, if you will. So there's the assessments. It's essentially the measures, it's the data. And then it helps to define either your issue, it defines your current state, it defines where you're at right now. And from that, you can use this information to develop strategies within evaluating your program or services, and then make the plan to implement the evaluation process. And so then, or the service. So then you implement and monitor. Monitoring is ongoing. Maybe it's monthly. You're pulling data. Maybe you're pulling your team together. You have a process set up where you sort of randomly have some anecdotal conversations with patients, whatever it might be. But it's a continuous cycle. So that's sort of the background of what I'm going to talk about today, which is one of the services that we offer through the HTRC. The National Quality Forum is a not-for-profit organization that uses a consensus model of experts across healthcare areas to inform on measures, essentially. And 40 experts were pulled in related to telemedicine and telehealth to help define some measurements that would lend to determining if your services are successful, areas that you need to work on. But then it also informs on where you may need to, build information, whether it's patient or care team education and training, equity, how you're building health equity concepts within your services. And so there was a rural healthcare system report that you can find online. And I have it too, if any of you want to do a deeper dive with it. And they came up with these domains. So let me get my notes really fast. So I want to. So the 5 domains that they narrowed down into where we need to then more fine-tunedly look at measures was access to care and technology. So this is the ability of telehealth to increase patients' access to certain types of care. It's and a lot of times they've looked at it from the perspective of emergencies, which we know that the public health emergency during COVID-19 kind of propelled us into, and now we're sort of in this new state, and we're here with it now. So it's not quite an emergency anymore. Now we're realizing that it increases access to care for so many people. Costs, business models, and logistics. So the cost of using telehealth, how does it support delivery models? What are the implications of that? So delivery models being, are you holding synchronous, real-time virtual appointments? Are there asynchronous, like store and forward with radiography or labs that you're providing or receiving from specialists that are maybe in larger areas, larger systems? Think of it in terms of like remote patient monitoring. Each one of those types of delivery models, they're going to have financial implications. When we talk about the digital divide, do your patients have tablets? Do they need tablets? Is there a cost to that? Is there a program that you can offer where maybe they check out a tablet if you're monitoring an acute illness as opposed to a chronic illness? So those are different things that you have to consider with the costs and financial plans that you're going to be working on. And then experience. This goes down to not just the patient experience, but again, pointing to the clinician or the care team experience. Both of those matter because they impact the interactions between the patient and the provider. So are their needs being met across on both sides? Are you doing satisfaction surveys? Are you gathering perceptions of processes or experiences from your clinicians? Effectiveness. What are the desired outcomes? What do you want to see what health improvements do you want to see within this telehealth service or this telemedicine program that you're developing? What are the outcomes? Is it chronic disease management? Is it for to reduce no-shows for follow-ups? Are you wanting to improve your follow-ups with your patients so that you're reducing readmissions into the hospital? And then how about timeliness? Are you improving the wait times now? They don't have to wait so long for that follow-up appointment. And then finally, equity. How can telehealth support equal opportunities for all people to have access to care and live quality, healthy lives? So I bring up the National Quality Forum because they really worked hard at these domains that I just talked about, but then offering what to consider, but then also measures, different types of measures, more generalized ideas. You would have to apply it to your specific clinic and what you're able to do. But what we did is today's conversation is about an assessment that has been part of HTRC called the eStart Readiness Assessment. It's been used for a long time, pre-pandemic. And now that we came out of the PHE last May, we realized that there's some things that we needed to adapt and edit so that we can provide this service to clinics that have these goals in mind for their telehealth services. And so we pulled from the National Quality Forum, and we made sure that we are asking questions that lend to these 5 domains. And then from there can help give recommendations for measurements or considerations and I'll get a little bit more into the details of the assessment in a minute. But we did create a crosswalk, and we wanted to also identify areas that were missing from our original assessment tool that we needed to add now. So now we're going to go a little into the evaluation process, and this is our the work that we would do with any clinic or health system requesting our assistance. So this assessment has been developed to be a team-based survey, essentially. The assumption is that it takes a team to provide your in-person services. It is going to take a team to provide the telemedicine or the teleservices as well. And so if you think about those priority areas, technology, billing, operations, finance, a lot of the clinics, you've got those folks there. And so what would their input be during the assessment? And so it's important to pull the team together and answer these questions together. So essentially, the clinic would request an eStart assessment from our team. And it is a electronic, but there's a link, we can collect it electronically. So we would do a quick meeting with the clinic or hospital, just to kind of let them know, okay, here's the expectations and the steps that this is what we'll do for you, with you, along your journey. So have an initial meeting just to make sure everybody can get their questions answered, the logistics of it, who gets the link, and that kind of stuff. So then the clinic takes the team-based assessment, and I say 2 weeks. All of these timelines, by the way, are very flexible. It's going to be dependent on what your team is able to do realistically. So then we receive the assessment results, and then we take a look at what you said your priorities were related to teleservices. And then we also look at the results. We see areas that you're doing well and how you can leverage those areas you're doing well, but then also areas that need a little work, and we can give you some recommendations on those areas. So ideally, you would then set your own goals. I say 6 months because we're currently working with FQHC to sort of test this process to make sure it's feasible and it's realistic for the clinic to be able to do these. So you set some priorities and some goals. These can be whatever they are for you, whatever fits your clinic. We can't really tell you what those are. We can make some recommendations, but it's going to be something that you're able to do within your scope. And let's say we implement it and it takes about 6 months. We check in from time to time, and then we help you readjust priorities if you realize along the way this isn't working, or you actually reached your goals pretty quickly. Now let's add another one. So we can work with you on that. And then you just give it then another 6 months, and we follow up with you and just see how things are going. And you can take the assessment again. You can see where you're at 1 year down the road, kind of a pre-test, post-test type model. But we're here to help with any questions that you have along the way. So this is an example of the areas that we have questions under that contribute to each one of these areas. So it's factored. They're factored questions, and it'll give you sort of this overarching, here's where we're at with organization and governance, current state, billing and funding. But those are kind of the subcategories where then there's questions underneath those that load into these primary focus areas. So I'll just give a couple of examples of the questions. So this one talks about how receptive your organization is to change. And this is an interesting question because if you think about it, you're doing a team-based responses. You're pulling the team together to do this, and you're going to have subjective opinions about it. And so but if you think of it though in the context of teleservices, or you're thinking of in the context of what you want to achieve, then this answer, this response might be a little bit different. Your current state, is your organization currently providing telehealth services? Yes or no? If yes, how many? And this is another important question, because if you're doing 1 to 2, you might still be in that area of, okay, we want to do this, we're doing it, but we don't have a lot of services currently. We do 1 to 2, maybe some follow-up appointments, but we're not really providing a ton of opportunities or options for these appointments. If you're doing 6 to 10 or above, you're pretty well in it, and you may already have be steps ahead in terms of some of the resources you would need to maintain them or to continue or to grow new services. Strategy. I wanted to put this in as an example on purpose. I've been talking to a couple of hospitals and clinics here and there. And one of the things we talk about is, do you have a teleservice or telehealth strategy? And in many instances, the answer was sort of, kind of. It's really important because there are different requirements to being able to deliver these things. Having a strategic plan can be really helpful. If you've got one, but it's pretty short term, or maybe it's just some random pieces that are in your overall organizational strategic plan, then we can talk a little bit more about what it would look like to make one specific to the teleservices you're interested in doing. So for the results and analysis, here's the side that we do. We take a look at the results. And like I said, the questions are factored. So each one has a point system assigned to it. So luckily, you don't need me to try to stumble through some of this stuff. We will have it do it for us, but it'll show areas of strength and areas of improvement. We can take a look and see how the areas align with your goals that you talked about, and then we'll pull together some recommendations. The final report will be completed, and the results and recommendations will be shared with your team. It's really important that we have opportunity to give recommendations, because this isn't intended to be a report that we always, the proverbial sits on the shelf and collects dust. We believe that if we have specific recommendations, then provide either tools we have at our fingertips, or connect you with a larger, other resources that might be outside of our purview or scope, to at least keep that momentum for you, then this turns into a report that you can use. So this is an example of basically a heat map. So if we look at the different levels, level 1 being, this is an area that really needs some improvement to achieve community engagement and consumer experience. We may need to look at our feedback and experience and reports on experience. Do we need to do more patient surveys? Are we doing patient surveys? Is a teleservice component part of the survey? Are we understanding the patient needs from that perspective? Many of clinics and hospitals they're already doing this, but is there a component related to teleservices that would really inform on their needs, what they would like to see, and what they would be willing to do? Whereas level 5, like payment models and regulatory awareness under billing and funding, level 5 means you've got a really strong report on this. Maybe you've got a really strong billing team that really monitors regulations, and state level and in federal level. They're attending a lot of CEUs. They're really on top of it. And so you've got a really strong area under billing and funding. So we may not need to focus on that as much. This is just another way to visualize what the how it might factor in. And so like I said, each question is given a number associated with it, and it factors into the heat map. So this is a little examples of what recommendations might be. So let's say you've got some perceived low support for adopting or expanding telehealth services. So we may come with ways to increase the self-efficacy that they can do it, that they want to do it, and it's a good idea to and it would help increase access and improve patient and clinician experiences. So maybe it's more training. It is a similar clinic that is successfully adopting services, and they're able to demonstrate how it increases access to specialty services. It's, including folks in the planning process, including patients in their person-centered kind of integrated care model, things like that. With current state, if you're not currently providing services, start small. Maybe there is an afternoon once a week that you would just focus on follow-up appointments, or you don't have to do these really large-scale programs yet if you haven't been implementing it or it's not embedded in your current services. Take a look at your in-person appointments, and look at what could we maybe turn into a virtual appointment. What would make sense? And then, of course, accessibility with broadband and whatnot. And then, of course, the strategy. If you don't have long-term plans, maybe that's something that you want to really think about. Do you want a 3 to 5 year plan? Maybe not that 1 year plan, or does it align with your organizational larger strategic plan, and how would it fit? So I'm going to go through a couple of resources. I don't know, some of you already may be familiar with these, but I do want to share them. The American Medical Association has a telehealth implementation playbook. I use this. I teach an introductory course. I use this to help drive some of the curriculum development. It's about 130 pages. You can download a free copy. I do believe you'll get the slides afterwards as well, so you can get the link. But it talks about the steps involved in planning, implementing, monitoring, and evaluating, and all the different things you need to consider during the whole process. It also aligns with those telehealth priority areas that we talked about. Like, all of these things kind of tie in, but then also the measures that you can consider with the National Quality Forum recommendations. So this is, I took this from the playbook. It's probably might be a little hard to see, but I'll kind of walk through it. And I think my point with this figure is to show where measurement and evaluation and quality improvement fits. You'll notice at the very bottom it says evaluate success, but along this whole process, you're collecting information. You're learning about your current services. You're learning about what you can and can't do. This figure starts with part 2, which is the more planning. The part 1 of the playbook is the pre-planning. This is where you kind of start having the conversations. You're talking to leadership, administration. You're taking a look at your state regulations. What can we do? And then part 2, you're really getting into it. And so you're going to start looking at the need. What needs do you have? What needs does the clinic have? What does your community need? And what are ways you can address those needs through teleservices? Defining success, another point of measurement. How are you going to know you're doing well? What is information you're going to need to collect? And what does that look like? What would success look like, no matter how big or small? You're going to be looking at vendors. You're going to be pulling, maybe talking to some colleagues at other clinics. You're going to pull from the TTAC website. And you're going to start thinking, okay, what do I need to do? What technology do I need? Your EHR may already have, the platform may already have functionalities for virtual appointments. Is it an extra cost? What will it take to onboard or train staff to use that next level, that add-on, if you will? Sometimes Zoom Health works, but sometimes it doesn't talk to your EHR. So you're doing another evaluation. But when you make the case, you're pulling this information together so you can take it to those that will essentially leadership or administration and say, yeah, we can do this. Let's start here. You're essentially putting it together. So you're getting this data, you're defining success, and you're going to have ideas for the vendor already in place. With part 3, we're looking at implementation. So now we're talking about what is the process or the workflow. You've got those in your clinics more than likely already, from start to finish. Like, when you schedule an appointment, how do you do it in the system? Who manages no-shows? How are you communicating with the patient when they cancel or no-show? how does this impact the clinician? Who's involved with ensuring the appointment goes well? What is a backup plan for technology if technology fails? So you're going into then the nuts and bolts of how things are going to work. So again, it's information. And then partnering with the patient. We talked about this earlier. What does the patient need? Do you know what they need? You may know from your current state, but what would they need for the teleservice? And then you're going to go into implementation, and then you can monitor it. You can do implementation monitoring, your quality improvement, maybe your PDSA cycles. They would really come into play during the workflow and process flow piece. Maybe also implementation with access. Wait, the technology piece. How fast do they get scheduled? Does this process work within our system? Is it taking too long to get them in the system and then send out a link? Do you have to walk the patient through a portal? How is this working? So you can embed those measures and how you're going to assess your processes and your successes and improvement areas throughout the whole cycle. So like I just went through, key areas that support evaluation in QI would be those things that I just pointed out. And then again, they can tie back to, if you think about the NQF measures, access to care, cost, experience, effectiveness, and equity, you're considering those things as you develop those measures and things that you're going to assess. So, of course, we already talked about HTRC as a resource. We have webinars. A primary focus, as you can imagine, has been reimbursements. And we have a outreach partner. She has multiple certificates and education with specific to coding and billing. And if you haven't seen one of her presentations specific to reimbursements, then we have archived them on our website and the YouTube channel. But she monitors CMS, so Centers for Medicare and Medicaid, remembering that Medicare is federal, whereas Medicaid is state specific. And so there's so much nuance that goes in with that billing, as many of you may already know. But they've added social determinants of health and then principal illness navigation codes as well. So the social determinants of health is interesting. And I've got a handout from CMS that I can send you that shows you codes for billing for the social determinants. We also go a little bit deeper depth in how that ties to telehealth or teleservice codes as well. And then we recently did some on e-prescriptions and then compact licensures. So right now that's been a major focus and it's been a major need, but we are working on other areas that can help with education. We did a telemedicine echo series. This is our current tentative topics that starts in March. I will be presenting again for our first echo. It'll be a little more condensed with in March, but then we will have one of our partners who has done quite a bit of strategic planning with telehealth at a large hospital, and he's going to help us with strategic plans and how to get started with one specific to teleservices. We will be doing reimbursement models with our other outreach partner I just talked about. We would like to bring in case examples. We did one last year with FQHCs and rural health clinics to just show kind of a case scenario where you have a unique situation. And this is how you can walk through and get the resources you need to understand how best to bill for that reimbursement. We will have one related to performance measures. And then we have some new resources related to avoiding digital burnout. And that's going to become, very important for care team members and clinicians. And then we're toying with a couple of other ideas as well. So you can get signed up for our newsletter, but then you can also visit our website and you can get registered for these. And then you'll get the updates specific to the echo if you register. So our Oklahoma resources, and I'm gonna go off slides in a minute, but first of all, we have Tim Davis. He is the telehealth manager for the OSU Center for Health Sciences. Some of you may know him. He's also an HTRC partner. He's my partner in crime with all things related to work that we do in Oklahoma. An excellent resource and very knowledgeable about a lot of telehealth and teleservices work happening in Oklahoma. And then I wanted to show you, this is going to be helpful if you think about the playbook, think about that pre-planning. You're just starting to kind of look at some things. If you go to, this is the Center for Connected Health Policy. They do a really good job keeping this as up to date as possible. And then we get emailed notices if we see anything changing with policy. I'm also part of the Telehealth Alliance of Oklahoma, and you've got some great folks on that group as well that do a really good job keeping updated and informed on regulations and policy. But if you visit the Oklahoma page, it talks right here about Medicaid. As I said, Medicaid's going to be different per state. So live video is reimbursed, store and forward is not. Audio only means phone, not a video component, and it's paid for as well. But you can go in and look at, if you have questions about private payer, some of the private insurance, it'll talk a little bit more about requirements. Parity is a big question. Again, I'm not an expert in these areas. This is why I have my partners. But there's service parity and then there's payment parity. And you can look at and see, what is required in the state of Oklahoma related to private payers. And then, and so on and so forth. So you can go to this page frequently and it'll tell you, more specifically what Oklahoma regulations are. And then if you go for licensure compacts, more and more states are participating. And I got to say, Oklahoma, again, that's our CCHP partner, but Oklahoma does a pretty good job with this. These are all the memberships across all different licenses that Oklahoma participates in. So if you are one that provides services within your state, but then there's a possibility that it could cross state lines. An example being, I have a family member that's right on the Kansas-Oklahoma border. There's quite a bit of things that they do in Oklahoma. And so if he's going to receive, they have a small rural town, if he's going to receive some sort of a service, but the practitioner or the clinician is in Oklahoma, then they probably participated in some sort of a licensure compact so they could provide that service. And so it's really good. If you have questions about that related to the people in your clinic and what they're providing, you can go in here and take a look at that. And then this is another piece that is interesting. It's going to deal with it's going to lend to the digital divide and the idea of increasing internet access, essentially. This is important when we're looking at teleservices. If your patients are living in such a remote or an internet desert that they can't connect, then it's not going to be a useful service for them. But there's each state received money from the broadband equity program, and Oklahoma received $797 million. And so that's to build infrastructure and develop programs to increase high-speed internet. And there's a 5-year plan on this website, and you can take a look at, what Oklahoma's plan, how they're going to make progress using these dollars. The reason why I bring this up is, as a clinic, think of it in terms of patient education. So as internet access increases, and all of a sudden upload times and download times are fast, and you're able to conduct a virtual appointment in real time, synchronous. What does that mean for somebody who maybe has never had access, or maybe they just use their phone and has used cell service? They don't have a tablet, or maybe they don't haven't had a laptop. Is there education you may need to do as this access improves? And that's one of the things that we're talking about at the national consortium level with our technology partners. And what does that mean for patient education? Because we don't want to be so advanced in this infrastructure, which is great, without bringing the patient digital literacy along the way. And then I'll go ahead and show you really quickly. If you go to our website and you go to request assistance, there is a button for an eStart assessment. And this goes through, we receive it, and then we will be in contact with you if it's something that you would like us to help you with. And then I'll take a look. Here's our TTAC partners. This lends to the pre-planning in the playbook again, looking at different toolkits that you may need in order to, electronic stethoscopes. Do you need, what about, cameras? What do patients need, depending on the service that you're going to provide? So these are things that you will start thinking about as you start developing the service. If you're building on existing services, do they require more technology? Does it require more tools? Or are you going to, stay within your current structure, but you just need to improve certain areas with it? So I think that, so now I'll see if anybody has any questions. It did go a little fast.
Please feel free. You can take yourselves off mute or put your questions in the chat.
I think, Lara, when you and I first spoke, there's questions about the how to get started. And so this assessment can help with that. And this is not an evaluation of how successful your clinic is or not successful as a whole. It's really about readiness, or whether it's to, like I said, to start brand new services or build on existing ones. Sometimes you want to do more, but you don't have the capacity or staffing or training to do more. And so what would that look like for you? And this assessment can help with that.
And we will be getting a copy of your slides, correct?
Yes, you'll get a copy of the slides. We are wrapping up the assessment, the tool. We are, like I said, we're putting it online. It is a link that you would receive. And so we are just putting the final touches on that. And then we are working very closely with an FQHC for over the next 6 months to just see how our process and our involvement with the process works. Does not mean that you can't get started now. We don't have to wait these 6 months that we're kind of working closely with the clinic to see how it goes for us to at least do the assessment and get started with recommendations and resources.
Okay, so once the link is live, can we send it out? Can you share it with us and we can send it out to all of our contacts along with the recording here?
So what I'll do is I will make sure you've got the slides as soon as we're finished, and you can get that sent out. I'll add the link to our website, so that, because we want you to fill out who you are, that you're interested in the eStart, so we have your contact information, because we don't want you to necessarily do the assessment and then you're not going to have access to the results without contacting us anyway. And you may not need a lot of our touch points. Maybe you want them, maybe you don't. It's going to be very dependent on what you want and what you think you need. So I'll send the link to the website that's specific to the request assistance page. That way you can get started in that way.
Okay, perfect. Real quick, as we're wrapping up, did anyone have a question? If you're watching the recording, please, and you'd like a copy of the slides or any information, please do not hesitate to reach out. And with that said, Dr. Brown, thank you so much for your time today.
Thank you for having me. Please email us if you have any questions. The contact information for HTRC will also be part of the slides.